Ben Franklin once said an ounce of prevention is worth a pound of cure. That sentiment rings true every day here at the emergency department at Seattle Children's. Any parent here would love to turn back time. Anything to have avoided this visit in the first place. Anything to keep their child safe.
Hi, I'm Dr. Ben Danielson, a pediatrician at Seattle Children's Hospital. I'd like to talk with you a little bit today about pedestrian safety.
Doctors at Seattle Children's want kids to avoid ER visits just as much as parents do. That's why they take the time to star in public service announcements over the airwaves and on websites to share important and specific safety information.
There's no question that the best way to protect your child when they're on a bike, a scooter, or skates is to wear an appropriately sized helmet.
They give tips, reminders, and advice that might keep them from seeing your child in the emergency room.
Wear a life jacket.
As ER docs, they'd love nothing more than to put themselves out of business, to never be needed again.
Each year, almost 5,000 children nationwide fall out of windows.
Such simple things as an open window at home or a hard hit at practice can turn an ordinary day into an emergency situation.
Make sure your child has the right safety gear and that it fits properly.
In an instant.
Those safety caps only work for so long.
Accidental poisonings send 50,000 children to the hospital every year nationwide.
I'm Dr. Suzanne Mazer, an emergency room doctor.
Dr. Suzanne Mazer sees an average of 3 or 4 cases in the Seattle Children's ER each week. Kids who've gotten into prescription pills or household cleaners because parents didn't take steps to keep them out of the hands and mouths of babes.
Because 2/3 of kids who are poisoned are kids less than age 5, and almost all of those are preventable. So an unsupervised kid getting into a medicine, just for a minute, the parent looks away and the child gets into a medicine.
Seattle Children's also hosts community events, educating and equipping families to keep kids safe.
This is only a trial.
Outreach events, such as this one at Green Lake, offer bike helmets and life jackets at low prices and properly fitted in hopes they'll get used and potentially save lives.
I think it's cool that they offer life jackets, since it should be required, definitely.
I think it's a great, excellent program, and I think everybody should take advantage of it.
The outreach, the education.
First, insist on adult supervision.
All of these ounces of prevention can add up and make a weighty difference.
Learn to swim.
Drownings, for instance, have dramatically decreased in the past few decades since Dr. Linda Kwan made it her mission to help stop such preventable tragedies.
We have worked really hard by trying to get families aware of the risks, and we've worked hard with the health department. They've been amazing leaders in this with us, partners with us, and we've worked to get legislation passed to make children safer, like wearing life jackets. And the health department has worked to have legislation to make our pools safer. And so all of this has contributed to, I believe, the reason why we're seeing so few drownings.
The ER at Seattle Children's is here when you need it.
You should wear a helmet too. Kids are more likely to wear a helmet if their parents do.
But hey, if you can avoid ever having to come here, even better.
Absolutely, prevention is the name of the game.